Good evening, my nurses. I hope you are fine and doing good, and I hope your family is also good. So last time you remember we are last 2-3 lectures we just discussed the questions on different topics. So today we will study about one topic. Our topic is hypokalemia. What is hypokalemia? Less potassium. Less potassium. So first we have to know what's the normal value of potassium. So normal value of potassium is 3.5 to 5. The normal value is 3.5 to 5 millimole per liter. So this is the normal value of potassium. If the potassium is lower than 3.5, if the potassium is less than 3.5, we are telling hypokalemia. So if our body has less potassium, this will be a potentially life threatening. Why life threatening? Because the less potassium will affect our all body system. So that's why hypokalemia is a life threatening, because it affects all body system. What's the causes of hypokalemia? So number 1 is actual total body potassium loss. Number 1, actual total body potassium loss. Mean our normal value is 3.5 to 5 millimole per L. So if our total body potassium is less, so this is also a cause of hypokalemia. So how it is happening? Why our body has less potassium? There is a reasons. So number A, in our one section, number A is excessive use of medication. Excessive use of medication. Which medications? As diuretics, corticosteroids. If patient is using too much steroids, diuretics, or inhaled albuterol, that we are using for asthma patients. So excessive use of medications, diuretics, corticosteroids, and inhaled albuterol is the cause of hypokalemia. Number B, in this section, number B, increase secretion of aldosterone, such as in Cushing syndrome. In Cushing syndrome, our aldosterone secretions are increases, and the reason is electrolyte imbalance. Due to increased secretion of aldosterone, electrolytes become imbalanced, and this is also a reason of hypokalemia. Third is vomiting and diarrhea. D is wound drainage, particularly gastrointestinal. Sometimes we are putting the NG tube, so secretions are coming from through NG tube, the drain we are putting. So due to this reason also, the reason is hypokalemia. E is prolonged nasogastric suction. Prolonged nasogastric gastric suction. F is excessive diaphoresis. Excessive diaphoresis, too much sweating. G is kidney disease. Kidney disease. What kidney disease is doing is impairing reabsorption of potassium. Impairing reabsorption of potassium. This is also the reason of hypokalemia. The second section, in the second section, the inadequate potassium intake. Inadequate potassium intake. For example, fasting, nothing by mouth. In the fasting condition and the nothing by mouth, also patient have the hypokalemia. Number 3, potassium, movement of potassium from the extracellular to intracellular fluid. So in which diseases the potassium is moving from extracellular to intracellular fluid? The number 1 is alkalosis. In the alkalosis state, and number 2 is hyperinsulinism. Hyperinsulinism. What is hyperinsulinism? Is a genetic disorder. What happened? The insulin cells of pancreas, our pancreas insulin cells, for example, the beta cells of pancreas, they are making the insulins. Beta cells secrete too much insulin. So due to too much insulin, what happening? The patient has less blood sugar, less plasma sugar, and that is hypoglycemia. So in this state also patient have hypokalemia. Number 4 is dilution of serum potassium. Why serum potassium is diluted? Number A, water intoxication. What is water intoxication? Hyperhydration. In that situation also patient have hypokalemia. Number B, IV therapy with potassium deficient solution. If patient is taking medicine that decrease the potassium level, is also can create hypokalemia. Now we will talk assessment. How we will assess patient have hypokalemia? So as I told you, if the patient have less potassium level, it is affecting our all body system. So we will talk system by system. So first we will talk cardiovascular. How our cardiovascular system is affected due to hypokalemia? What's the assessment we have to observe? Thready, weak, irregular pulse. Weak peripheral pulses. We can tell thready, weak, irregular pulse. The weak peripheral pulses. Orthostatic hypotension. We can also tell postural hypotension. Then dysrhythmias. dysrhythmias. What is dysrhythmias? The irregular or abnormal heartbeat. Irregular or abnormal heartbeat. That is cardiovascular. Now we will talk. The next system is respiratory. How our respiratory system will affect due to hypokalemia? Shallow, ineffective respiration. Shallow, ineffective respirations. Why we have shallow, ineffective respiration? Result from profound weakness of the skeletal muscles of respiration. Skeletal muscles of respiration. So hypokalemia is affected our respiratory system also. Our respiration is shallow, ineffective respiration. Why? Because the skeletal muscles of respirations become weakened. Due to this reason, the patient have shallow, ineffective respirations. Now neuromuscular. In the neurovascular, patient have anxiety, lethargy, confusion, and also coma. Due to the hypokalemia is also affective neuromuscular system. Anxiety, lethargy, confusion, and coma. Now the skeletal system. How skeletal system is affected due to hypokalemia? Skeletal muscles weakness. Skeletal muscles weakness. Leg cramps. Patient will feel leg cramps. Deep tendon hyporeflexia. What is deep tendon hyporeflexia? An absent or diminished response. An absent or diminished response to tapping. Mean once the doctor is tapping to the this tendon, there is an absent and diminished response. That is deep tendon hyporeflexia. Then paraesthesia. Paraesthesia mean abnormal sensation of the skin. Abnormal sensation of the skin. That is the also cause of hypokalemia. Now gastrointestinal. Gastrointestinal, decrease motility, hypoactive to absent bowel sounds. Absent bowel sounds. Nausea, vomiting, abdominal pain, distension, abdominal distension, constipation. That is all related to gastrointestinal due to hypokalemia. Now the laboratory findings, or we can say investigations. Which investigations will show the patient have hypokalemia? So first we will check the serum potassium level. If is less than 3.5, it means patient have hypokalemia. Then the ECG changings. ECG changing is very important. This question is coming in the exam. So ECG changes, how you will see. For example, I will draw one picture. For example, this is, for example, is a normal hypokalemia picture. Normal is a normal ECG. Q R S T. This is P. P Q R S T. This is the normal ECG. This is the normal ECG picture. But if the patient have hypokalemia, what picture you will see in the ECG? Sorry, my drawing is not good, but I just want to the difference. So if you see in the normal ECG, the P wave is normal P wave. But if you will see, so this is P Q R S T. So if we will see in the hypokalemia ECG picture, the slightly peaked T wave, slightly peaked P wave. The P wave is slightly peaked, and the PR interval, see there is PR interval is good, normal PR interval. There is slightly prolonged. Sorry, my drawing is not good, but when you will see the ECG, the proper ECG, there will be a slightly prolonged PR interval. So slightly peaked P wave and slightly prolonged PR interval, and ST depression. ST depression. See, there is ST is a proper ECG, but here is depression. ST depression, shallow T wave. There is good P wave, but here is shallow because there is ST depression and the T wave is shallow. Prominent U wave. Prominent U wave. This is U. Prominent U wave. So in the hypokalemia, what ECG changes? Prolonged PR interval slightly. This P wave is peaked. ST depression, prominent U wave, and shallow T wave in the hypokalemia. What intervention we will do? Intervention for hypokalemia. Hypokalemia, yes. So our intervention is monitor electrolyte values. Monitor electrolyte values, very important. Then we know what's the potassium level of the patient. Administer potassium supplements. Potassium supplements administered orally or intravenously. Orally or IV. Oral potassium supplements. Oral potassium supplements. Very important, the question can come in the exam. How you will give oral potassium supplement to patient? So oral potassium supplements may cause nausea and empty stomach. Nausea and vomiting. The oral potassium supplements cause nausea and vomiting. So always should not be taken on an empty stomach. If your stomach is empty, never take oral potassium supplements. If the client complains of abdominal pain, distension, nausea, vomiting, diarrhea, or any gastrointestinal bleeding, the supplement may need to be discontinued. So the oral potassium supplements causes this all problems, nausea and vomiting. Never take with empty stomach. Never take with empty stomach. And if patient complains this all problems, stop the oral this potassium supplements. Then number B is liquid. If you are giving liquid potassium to the patient, potassium chloride is an unpleasant taste. The taste is not good, unpleasant taste. So always give with the juice or an other liquid. Always give with the juice or any other liquids. So the patient taste will be good. IV potassium. How we are giving IV potassium? The potassium replacement that we are giving through the IV infused through a central line due to the high incidence of IV infiltration. So potassium, try to use central line. Never give IV push. Never give IV push. Not intramuscular. Not intramuscular or subcutaneous. Never give IV push. Never give intramuscular. Never give subcutaneous. IV potassium is always diluted and administered using an infusion device. Always diluted plus infusion device. Very important. Never give IV push. Never give intramuscular. Never give subcutaneous. Always diluted and infusion device. And if you are giving IV potassium, always continuous cardiac monitoring. Very important. And ensure the IV bag containing potassium properly labeled. Properly labeled. Because potassium infusion can cause phlebitis. Therefore, the nurse should assess the IV frequently for signs of phlebitis or infiltration. If either occurs, the infusion should be stopped immediately. So, potassium causing infiltration and phlebitis. So, if this problem will happen, immediately stop the potassium. The nurse should assess renal function before administering potassium and monitor intake and output during administration. So, before giving potassium, always check the kidney functions, RFTs and urine output. The maximum recommended infusion rate is 5 to 10 MEQ. 5 to 10 MEQ per hour. Never to exceed 20 MEQ per hour under any circumstances. Always give 5 to 10 MEQ per hour. Never to exceed 20 MEQ. In any circumstances, we are giving 5 to 10 MEQ per hour. If the client is taking potassium losing diuretics, it may be discontinued. If patient is taking the potassium medicine that will decrease the potassium level, so it may be discontinued. And what we will give? Potassium sparing retaining diuretics. Potassium sparing mean retaining diuretics. We will use the diuretics that will increase the potassium level. And number last, always instruct the patient to take potassium containing food. Potassium containing food. What is the potassium containing food? Mostly in the exam this question is coming. They will give you some variety of foods. There is a 4 option and they will tell you select which food is potassium containing foods. We will advise to the patient for the hypokalemia case. So what is the foods that is containing potassium? All meats, red meat and chicken. Red meat and chicken, fish, especially salmon, cod. This is the fish names. Cod, sardines. This is the fish names. Then soy products. Soy products, veggie burgers. Soy products, veggie burgers, especially the vegetables. Especially which vegetables contain broccoli, peas, beans, tomatoes, potatoes, particularly the sweet potatoes. And which fruit is good? Fruit that containing potassium, citrus, cantaloupe, bananas, kiwi, dried apricot. Milk and yogurt, and nuts. These are all containing the high potassium level. So whenever you will give foods to the hypokalemia patients, always give the food that containing the potassium. I hope you like the lecture. If you like, please share and subscribe my channel. And don't forget to push the icon bell button so you can receive my coming video notification. Thank you very much. Take care of yourself and family. Allah Hafiz.